Well, hello, everybody. And first, I want to thank you for inviting me today. I can tell you that as a mother of three, I had much trepidation when I was pregnant to use medical products. And one might say, well, Sarah, given what you do for a living, perhaps you have a heightened awareness. And I would say that is probably true. So I think you're doing very important work, and I'm happy to be here to support it in this small way. I want to tell you a little bit about my company, but mostly I want to talk to you about insurance companies in general and how they evaluate this sort of risk. I will also say to you that I do have slides, and I deliberately made them quite wordy. I don't know that I'm going to get to them today, but really I wanted to give them to you as some notes, things that I hope you consider or maybe have curiosity about, and I can be available to anybody following this meeting if you wish to explore any particular area further. So let me say that Medmark is, I've worked there for 19 years. I'm in charge of the underwriters, and I'm in charge of risk management services. I am a lawyer by training. I've come to the medical world sort of via this job and have found it to be a fascinating space. I will say that my company is unique in the world and that we have a unique beginning. We were started in the 1970s when medical device manufacturers could not get insurance. And I think this is going to go to my larger point to you. They could not get insurance. And so through their trade association, they started my company as a mutual insurance company. In the 40 plus years that we've existed, the world has changed quite a bit. We now have about 20 competitors all wishing to underwrite this business, which has an impact on the marketplace and has an impact on how readily pregnant and lactating persons can find insurance. We are also no longer a mutual insurance. We are a subsidiary of a large publicly traded company. And this brings me to my first point. I do want to talk about the fundamentals of, I don't think this is set in slide mode, but I do want to talk a little bit about the fundamentals of insurance. And so the things I'm going to say to you are a little bit nuts and bolts, a little bit practical. In fact, it may be things that you intuitively know about insurance, but maybe don't spend a lot of time thinking about insurance as I do. And the first is that the vast majority of companies providing insurance in this space, when I say this space, I mean to life sciences manufacturers and distributors, so both medical devices and drugs, biotech, is that these are for-profit enterprises. So as a for-profit enterprise, the company makes decisions to preserve its business and to grow its business. And fundamental to the insurance business is making the right decisions about perceived risk. So the insurance model is that you wish, it's a bit like gambling. You wish to align yourself with an insured that is safe, that is a lower risk. And you want to hold on to that relationship over time so that the company, through its premiums over time, pays for its own losses. Much like a savings and loan, when the premium is not being deployed to pay for claims, you, the insurance company, want to take that money and invest it. And between holding on to the money through safe products that don't give rise to litigation, as well as through investment, you hope that that insured is able to pay its own way through the system. So in order to do that, you need to make very wise choices about the companies you insure. I'm going to turn to an example from personal lines because I think we can all relate. We all buy insurance in some form or another. So if you were to speak to someone who has put a pool in their backyard, has multiple drunk driving arrests, or owns one of the 5 breeds of dogs that is likely to bite a human, and you were to ask that person, what was your experience buying insurance? You are likely to hear one of 3 things. 1, it was hard for me to find a carrier. 2, my premiums really went up. It's expensive. And in the very worst case scenario, that person might say to you, I can't get insurance. So to bring this to life sciences, let me list some products for you that are difficult to insure, either at one point in history or now. And I think you will readily recognize why I list these. So first we have latex. silicone, contraceptives, particularly female contraceptives, and you really have the Delcon shield to thank for that, though birth control pills have been problematic more recently. IVC filters. At one point in time, vaccines, which I think could be an interesting model for you, by the way. I'll get to that in a minute. And then most recently, opioids. So these are very, very tricky products to insure because that money transfer that I described in the beginning, where you want the insured to pay their own way over time, is economically impossible. You simply cannot charge an opioid manufacturer enough premium to ensure that they pay their own way. It's impossible. And these products therefore become uninsurable. To our point today, I do not believe that pregnant and lactating persons are as far on the extreme as the products I just described, but you are certainly on that end of the scale. And I can get into how those products are underwritten if you're interested in that. One impression I want to leave with you today is that right now, if there is a time in insurance history for life sciences companies when it's easy for this population that we're talking about today to get insurance, the time is now. And that might surprise you because I know it is tricky to insure this population group. But here's the reason why. Insurance goes through natural cycles of boom and bust. If the world perceives that a certain industry is safe or there's a lot of capital out there that you want to put towards a type of insurance, carriers rush in to do business there. Again, this is that for-profit enterprise. They believe it's safe, they believe they can make money, and they rush in to insure that particular type of risk. Over time, the landscape changes. Remember, I said we were founded when you couldn't get insurance, and now we have 20 competitors. Well, insurance for life sciences companies, because of this boom and bust cycle, is relatively inexpensive now. So I urge you, you have a window here where the persons that you're talking about today, you can insure those trials. But as the market changes, it will grow increasingly harder. So if there's any urgency to your work as relates to insurance, I would say this is a good time to try to make changes.